You are hurting your kidneys by doing this every day. Every single day, without even realizing it, you might be engaging in seemingly harmless activities that are seriously compromising your kidney health. These vital organs, which function as sophisticated filtration systems in our bodies, are responsible for purifying blood, eliminating toxins, and maintaining proper fluid balance. However, our daily choices often subject them to incredible stress, leading them toward gradual but relentless deterioration. Kidney function impairment can manifest through various warning signs: persistent feelings of exhaustion, swelling primarily located in your ankles and hands, sleep disturbances, and significant changes in urinary patterns. You might notice that your urine has an unusual color, appears cloudy, or you find yourself waking up frequently during the night to use the bathroom. These signals shouldn't be ignored, as they could indicate the onset of serious conditions like chronic kidney disease, stone formation, or even complete kidney failure. Now I'm going to reveal the 10 most harmful daily practices for your kidneys, ranked in ascending order of danger, with the most devastating one revealed at the end. Number 10. Dehydration. Insufficient fluid intake represents one of the most underestimated threats to kidney wellness. Our kidneys depend critically on water to effectively perform their cleansing function. When our body doesn't receive adequate water intake, waste products, toxins, and excess minerals tend to concentrate in the blood, making the filtration process extremely laborious. This excessive concentration can promote the crystallization of mineral salts, giving rise to the formation of painful kidney stones. Additionally, chronic dehydration predisposes you to urinary tract infections and can accelerate the degenerative process that leads to chronic kidney disease. Particularly dark urine or urine with a pungent odor represents a clear signal that your body needs greater hydration. To maintain optimal kidney health, you should consume at least half a gallon of water daily, increasing this amount if you engage in intense physical activity or live in particularly hot climates. Number 9. Over-the-counter painkiller abuse. The reckless use of over-the-counter pain relievers constitutes a silent but devastating threat to kidney health. Common medications like ibuprofen, aspirin, and naproxen, while effective in controlling pain and inflammation, can cause irreversible damage if used improperly. These drugs, classified as non-steroidal anti-inflammatory drugs, work by blocking specific substances that cause inflammation, but simultaneously significantly reduce blood flow to the kidneys. This decrease in blood flow severely compromises the organ's filtering capacity, and prolonged use can cause acute or chronic injuries. If you regularly rely on these medications to manage pain, it's essential to consult a doctor to explore alternative therapies that are safer for your kidneys. Before we continue, if you're finding this content helpful, I strongly encourage you to subscribe to the channel, hit the like button, and turn on notifications so you don't miss our upcoming health insights. Number 8. Excessive sodium in your diet. Excessive salt consumption represents one of the most insidious enemies of kidney health. Most people ingest amounts of sodium far exceeding their body's actual needs, primarily through industrially processed foods, takeout meals, and restaurant dishes. High sodium intake forces the body to retain greater amounts of fluids, causing an increase in blood pressure. Hypertension represents one of the main causes of kidney deterioration, as it progressively damages the delicate blood vessels of the organ, compromising their filtering functionality. In the long term, this condition can evolve into chronic kidney disease or worsen pre-existing kidney conditions. To protect your kidneys, drastically reduce salt addition during food preparation, favor the use of herbs and spices to flavor dishes, and always choose fresh foods over industrially processed ones. Number 7. Holding your urine. Constantly postponing urination might seem like harmless behavior to you, but it actually represents an extremely harmful practice for the entire urinary system. When you deliberately ignore the urinary urge, you allow the bladder to fill excessively, creating abnormal pressure on the kidneys and the entire urinary apparatus. This habit can trigger a series of serious complications, including recurrent bladder infections and pathological urinary retention. Stagnant urine in the bladder becomes a breeding ground for bacterial proliferation, drastically increasing the risk of urinary tract infections that, if neglected, can travel up to the kidneys, causing permanent damage. Chronic retention can also weaken bladder muscles, compromising their complete emptying capacity and promoting stone formation. It's essential to always listen to your body's signals and never postpone urination when you feel the need. Number 6. Excessive sugar consumption. Excessive intake of sweeteners and sugary drinks represents a threat often underestimated for kidney health. High sugar intake can trigger a series of metabolic disorders, including obesity, insulin resistance, and ultimately type 2 diabetes, which constitutes one of the main causes of kidney failure. Consistently elevated blood glucose levels progressively damage kidney capillaries, compromising their filtration capacity. This degenerative process can evolve into diabetic nephropathy, a serious complication that can lead to end-stage kidney failure. Carbonated drinks, industrially sweetened teas, and energy drinks cause dangerous blood sugar spikes and contribute to obesity, further amplifying the risk of kidney diseases. Replace these products with natural alternatives like fresh fruit, nuts, or water flavored with citrus. Number 5. Excessive caffeine consumption. Caffeine, present in coffee, tea, and energy drinks, represents the stimulant that many of us rely on daily. However, excessive consumption can be particularly stressful for the kidneys. Excessive caffeine intake causes a significant increase in blood pressure, and prolonged hypertension irreversibly damages kidney blood vessels, reducing their filtering efficiency. Additionally, caffeine possesses diuretic properties, increasing urine production and potentially causing dehydration if not compensated with adequate water intake. Dehydration forces the kidneys to work under stress conditions, promoting stone formation and other complications. To preserve kidney health, limit caffeine intake to no more than 400 milligrams daily, equivalent to about 4 cups of coffee, and make sure to always maintain optimal hydration. Number 4. Sleep deprivation. Inadequate nighttime rest doesn't just represent a problem for the brain and daily energy, but also plays a crucial role in maintaining kidney health. During sleep hours, the body activates fundamental repair processes, and the kidneys particularly benefit from this regeneration period. Chronic sleep deprivation interrupts these natural repair mechanisms and alters the hormonal balance that regulates kidney function, particularly influencing blood pressure control. Nighttime hypertension can cause continuous stress on the kidneys, while lack of rest prevents cellular regeneration processes. Scientific research demonstrates that sleep deficiency contributes to the development of insulin resistance, obesity, and hypertension, all significant risk factors for kidney diseases. Aim to sleep at least 7 to 8 hours every night to allow your kidneys the rest necessary to stay healthy and functional. Number 3. High-protein diets. Although proteins constitute an essential component of a balanced diet, excessive consumption, particularly of animal proteins, can significantly overload the kidneys. When you metabolize proteins, your body produces nitrogen waste like urea, which the kidneys must eliminate through filtration. A protein-rich diet intensifies the kidney workload, forcing these organs to function beyond their optimal capacity to eliminate excess nitrogen waste. Over time, this overload can cause kidney deterioration or worsen pre-existing conditions, especially in individuals already predisposed to kidney problems. Animal proteins, like red meat, poultry, and dairy products, also contain high amounts of phosphorus, which can accumulate in the blood, further overloading the kidneys. To protect kidney function, balance protein intake by including greater amounts of plant proteins and reducing consumption of animal products. Number 2. Smoking habit. Smoking represents one of the most serious threats to overall kidney health. The harmful chemicals present in cigarettes directly damage blood vessels throughout the body, including those that supply the kidneys, severely compromising their functionality. Smoking also accelerates atherosclerosis, narrowing the arteries that supply blood to the kidneys and drastically reducing kidney filtration efficiency. This degenerative process can quickly lead to kidney failure and significantly increases the risk of developing kidney tumors. Quitting smoking represents one of the most effective decisions you can make to improve not only your kidney health, but your overall well-being. Benefits begin immediately after abandoning this habit, progressively reducing the risk of serious complications. Number 1. Constant high blood pressure. The most devastating and common practice that can damage your kidneys daily is constantly maintaining elevated blood pressure. Hypertension is often called the silent killer because it can cause progressive kidney damage without manifesting obvious symptoms. Over time, elevated blood pressure irreversibly damages the delicate kidney blood vessels, compromising their ability to effectively filter waste from the body. As these vessels weaken and scar, the kidneys progressively lose their functionality, potentially evolving into chronic kidney disease and, in the most severe cases, end-stage kidney failure. Hypertension also constitutes one of the main causes of cardiovascular diseases, further complicating the situation since heart and kidneys are closely interconnected from a functional standpoint. The damage caused by hypertension is cumulative. The longer pressure remains elevated, the greater the likelihood of causing permanent kidney damage. To effectively protect your kidneys, it's essential to manage blood pressure through lifestyle modifications, such as balanced nutrition, regular physical activity, stress management, and sodium intake reduction. Regular medical checkups can help monitor pressure and prevent long-term kidney damage. These are the 10 daily habits that could silently compromise your kidney health. From insufficient hydration to excess salt, caffeine, or protein, to the dangerous retention of urine, these behaviors may appear insignificant, but have a devastating impact on kidney function over time. Through simple modifications to your lifestyle, such as maintaining optimal hydration, reducing consumption of sugary foods, and carefully managing blood pressure, you can effectively protect your kidneys and keep them in perfect health for many years. Always remember that kidneys play a fundamental role in your overall well-being, so take care of them with maximum attention. I would love to hear what you think in the comments below. Subscribe to the channel and activate the bell so you don't miss any content, and thanks for watching this video.